Hello and welcome. If you are watching this, it's likely because you've been told something devastating by a doctor or a specialist. You've likely been told that your cartilage is wearing away, that your joints are bone on bone, and, here's the worst part, that there is absolutely nothing you can do about it except manage the pain until you get surgery. I need you to take that belief, that fear, and set it aside for the next 20 minutes, because I am going to show you that the medical establishment's view on wear and tear is fundamentally flawed. We often think of our bodies like cars. My car is red. Maybe yours is silver. If the tires on my red car wear down, the car cannot grow new rubber. The tires are dead material. But your body is not a car. Your body is a living, biological organism that is constantly regenerating. Your skin heals after a cut. Your bones knit back together after a break. So why have we accepted the lie that cartilage is the only tissue in the human body that cannot heal? It's not true, and today I am going to show you 5 specific foods that provide the raw materials to restart that healing process in your knees, hips, and spine. The number 1 food on this list, which surprised even the researchers at top universities, is something sitting in your refrigerator right now. Take Margaret, for example. Margaret is 71 years old from Phoenix. When she came to me, her world had shrunk. She used to love walking her golden retriever, but the pain in her knees had become so sharp that she couldn't make it to the end of her driveway. She was depressed, she was gaining weight from inactivity, and she was terrified of knee replacement surgery. Her doctor said, "Margaret, the cartilage is gone. It's a mechanical issue." But 3 months after changing what she ate for breakfast, Margaret is walking a mile every morning. That is not a miracle. That is biology. Before we get to the foods, we have to understand what is actually happening inside your joint. If you don't understand the problem, the solution won't make sense. I want you to visualize your cartilage like a heavy-duty kitchen sponge. It sits between your bones, the femur and the tibia, and it acts as a shock absorber. When you are 20 years old, that sponge is thick, wet, and bouncy. When you take a step, water is squeezed out to absorb the shock. When you lift your foot, the water rushes back in. However, cartilage has a problem. It has no blood supply. Your muscles have blood vessels delivering nutrients every second. Cartilage does not. It relies entirely on that squeeze and release mechanism to suck in nutrients from the surrounding fluid. As we age, 2 things happen. The sponge dries out, the protein structure, collagen, starts to fray, the factory slows down. The cells responsible for repairing the cartilage, called chondrocytes, become sluggish. Most people think osteoarthritis is just wearing out. It's actually an active disease process where the repair crew has gone on strike because they ran out of materials. A landmark study from Tufts University followed over 2,000 adults for a decade using MRI scans. They proved that people who kept the repair materials high in their blood showed 47% less cartilage loss. So how do we wake up those repair cells? We have to feed them. Let's look at the 5 foods that act as the fuel. Number 5 on my list is bell peppers, specifically the red ones. Now, I can hear you asking, how is a salad vegetable going to save me from knee surgery? It comes down to one biochemical law. Human beings cannot produce collagen without vitamin C. Collagen is the scaffolding of your cartilage. It's the steel frame of the building. If you have plenty of protein but no vitamin C, your body literally cannot weave the collagen fibers together. It's like trying to build a brick wall without mortar. The bricks just fall down. A major study published in the Annals of Rheumatic Diseases followed 25,000 people. They found that those with the lowest vitamin C intake had a 300% higher risk of developing painful arthritis. So why bell peppers and not oranges? Marketing tells us oranges are the king of vitamin C. Biology tells us otherwise. One medium red bell pepper contains over 150 milligrams of vitamin C. That is double what you get from an orange. Furthermore, citrus is highly acidic. Many of my patients over 60 suffer from acid reflux or sensitive stomachs. Bell peppers give you the payload without the heartburn. The protocol? I want you to treat this like a prescription. You need about half a red bell pepper every single day. Crucial tip: eat them raw. Vitamin C is heat sensitive. If you roast them or stir-fry them to death, you destroy the medicine. Slice them up and dip them in hummus or chop them into a salad. This is the spark plug that turns the collagen factory back on. If peppers are the architect, food number 4 is the brick truck. Number 4 is bone broth. This is different from the stock you buy in a carton for soup. Real bone broth is simmered for 12 to 24 hours. Why does that matter? Because bones are made of collagen. When you simmer them for that long, the collagen breaks down into a substance called gelatin, and it releases specific amino acids: glycine, proline, and hydroxyproline. These aren't just random proteins. These are the exact triple helix structures that make up your own cartilage. When you drink bone broth, you are essentially drinking liquid cartilage. There was a patient of mine, Eleanor, 73 years old. She had tried every supplement on the shelf: glucosamine, chondroitin, turmeric. Nothing worked. She was skeptical when I told her to drink soup, but here is the mechanism she didn't understand: bioavailability. Many pills are hard for an older gut to break down. Bone broth is pre-digested. It passes through the gut wall and goes straight to the bloodstream. After 6 weeks of 1 cup a day, Eleanor called me. She said, "Dr. Michael, I walked around the grocery store for 45 minutes yesterday. I didn't lean on the cart once." The protocol? You need 1 cup, 8 ounces a day. Best time? First thing in the morning on an empty stomach. This signals your body to absorb these amino acids before competing with other foods. Sourcing? Look for bone broth on the label, specifically looking for 10 grams of protein or more per serving. If it creates a jelly when you put it in the fridge, that is the good stuff. That jelly is the collagen waiting to heal your knees. We have the architect, peppers, and the bricks, broth. Now we need the firefighter. Food number 3 is fatty fish: salmon, mackerel, sardines. Why do we need a firefighter? Because osteoarthritis is not just mechanical, it is inflammatory. When cartilage frays, microscopic debris floats into the joint space. Your immune system sees this debris and attacks it. This creates inflammation, swelling, heat, redness. This inflammation produces enzymes called metalloproteinases. These enzymes actually chew up cartilage. It's a vicious cycle. The damage causes inflammation, and the inflammation causes more damage. You have to put out the fire. This is where omega-3 fatty acids come in. Omega-3s are the most potent natural anti-inflammatory compounds we have. They work on the same biological pathways as NSAID painkillers, like ibuprofen, but without destroying your stomach lining or damaging your kidneys. A study from Harvard Medical School analyzed data from 30,000 women. They found that regular consumption of omega-3s didn't just stop the pain, it actually slowed the progression of the disease. The protocol: you need 3 to 4 ounces of fatty fish 3 times a week. The trap: do not buy farm-raised tilapia or catfish. These fish are often fed corn and soy, which makes them high in omega-6 fatty acids. Omega-6 increases inflammation. It throws gas on the fire. You want wild-caught salmon or canned sardines. Sardines are actually a super hack because you eat the tiny bones, getting extra calcium along with the omega-3s. Number 2 is a food that almost nobody associates with joints: pumpkin seeds. These seeds are the ultimate source of a mineral that 80% of seniors are deficient in, magnesium. Why does your knee care about magnesium? 2 reasons. Calcification. Without enough magnesium, calcium doesn't go into your bones. It gets deposited around your joints in the soft tissue. This leads to bone spurs and stiffness. Magnesium guides calcium to the right place. Muscle tension. Often, knee pain is made worse because the quad and hamstring muscles are tight, pulling on the joint. Magnesium is nature's muscle relaxer. I had a patient, Robert, a retired engineer. He had noisy knees, creaking and popping every time he stood up. He also had leg cramps at night. Those 2 things are connected. I put him on a pumpkin seed regimen. Within 3 weeks, the night cramps were gone. By week 6, the creaking in his knees had reduced by 50%. His muscles finally relaxed enough to let the joint track properly. The protocol? 2 tablespoons a day. How to eat them? Do not get the ones covered in heavy salt and oil. Raw or lightly roasted is best. Sprinkle them on your oatmeal, put them in yogurt, or just eat them as a snack. They are also loaded with zinc, which aids in cell division, vital for repair. And now we arrive at number 1, the food that ties this all together. Eggs. For years, eggs were demonized because of cholesterol. We now know that dietary cholesterol has very little impact on blood cholesterol for most people. But what we missed during the anti-egg years was that eggs are a joint superfood. Eggs contain something rare in the modern diet, sulfur. Specifically, sulfur-containing amino acids like methionine. Why is sulfur critical? Because your cartilage is made of something called glycosaminoglycans, or GAGs. You might know them as glucosamine and chondroitin. You pay $40 a bottle for them at the pharmacy. But your body can make them for free if it has sulfur. Sulfur is what gives cartilage its squishiness. It creates the bonds that hold water inside the sponge. If you are sulfur deficient, your cartilage dries out and hardens. Let's talk about Harold, 76 years old, bone on bone, scheduled for surgery in July. He came to see me in April. He didn't want the surgery because his brother had a bad reaction to anesthesia. I told him, Harold, eat 3 eggs a day, the whole egg. The yolk contains the vitamin D. He did it. He also added the peppers and the broth. In July, he went for his pre-op exam. The surgeon bent his knee, twisted it, and watched him walk. The surgeon was baffled. He said, Harold, your inflammation is gone and your range of motion has doubled. I can't in good conscience operate on a knee that is working this well. The protocol? 2 to 3 eggs daily. Preparation, scrambled, poached, boiled, it doesn't matter. But eat the yolk. The yolk contains the vitamin D and the choline. The synergy? If you make a 3-egg omelet with spinach and red bell peppers, you have just created the ultimate joint healing meal. You have the sulfur, the protein, and the vitamin C all on one plate. So here is your roadmap. Morning, 1 cup of bone broth. Breakfast, 3 eggs with red bell peppers. Snack, pumpkin seeds. Dinner, fatty fish 3 times a week. You do not have to accept that your body is broken. You do not have to accept that decline is inevitable. The machinery to rebuild your knees is sitting inside you right now, dormant, waiting for you to turn the key. These foods are the key. I want to challenge you. Don't just watch this video and nod your head. Go to the grocery store. Buy the eggs, buy the peppers. Try this protocol for 30 days. That is all I ask. 30 days to save your joints. If you found this helpful, please share this with someone you love who is suffering in pain. You might just change their life. Okay then, I'll see you in the next video.